my name is Caitlin Smith. I'm a registered nurse, and today we are going to be doing a neuro assessment. Today my patient is a 49-year-old male, Caucasian. His vital signs are within normal limits. Before we start our neurological exam, I would want to inquire him about any history, any neurological history that he has, any history of strokes, anything like that. Our patient denies any history of any abnormalities concerning the neurological system. To start the neurological assessment out today, we have got the Snellen eye chart, and I have placed my patient 10 feet away from the Snellen eye chart. And what we're going to do is I'm going to ask him to leave both of his eyes open, and let's see, sir, I want you to read the furthest line down. Just read whichever line you can read the furthest line down before it gets too blurry for me.
Okay, be line 6 would be E, D, F, C, Z, P.
Okay, so our patient with both eyes open, they have 20/40 vision. Okay, now I want you to close your right eye, or cover your right eye, and read the lowest line for me.
Line 6, C, D, F, C, Z, P.
Okay. Our patient has got 20/40 vision in the left eye. Now I'm going to have the patient close his left eye. Okay. And read the lowest line.
Line 6, E, D, F, C, Z, P.
Okay. Our patient also has 20/40 vision in the remaining ocular view. You would ask him, let's see, do you have any corrective lenses? Do you wear any corrective lenses or glasses?
No.
Okay. All right. Now, as I ask the patient to walk and sit back down, what I'm doing is I'm observing their gait. So I'm going to have you just to kind of walk back towards this way. And, okay, if you will, just stop for me. And before you sit down, I'm going to get you to, can you walk heel to toe for me? Okay. Okay. And then turn around. And if you will, walk on your tiptoes. Okay. And then walk on your heels. Okay. Now, if you will, just have a seat for me. And what you're doing is you're looking for normal gait, making sure that the patient has equal strength in both legs. Now that our patient is sitting down, the next thing that I'm going to do is we can check cranial nerves. And if you will, just close your eyes for me. I've got a scent here. I want you to tell me what this smells like.
Alcohol.
Okay, alcohol and hand sanitizer, that's correct. Another test that we're going to do, if you will, just keep your eyes closed. Okay. And you're going to tell me, is this rigid or is this soft?
Rigid.
Okay.
Soft.
Okay.
Soft.
Okay.
Soft.
This one?
Soft.
Is this rigid or soft?
Soft.
Okay. You can open your eyes now. So the patient has reported soft and rigid. We would want to further assess as far as our patient's nerve endings, because he was reporting soft and it was rigid. So we may want to follow up with a primary care provider. Let's see, the next thing that we can do, if you will, just stand back up for me again. And I'm going to get you to close your eyes, and what I'm doing here is I'm performing a Romberg test. I'm going to count for 30 minutes. for 30 seconds. Okay. And we're looking for any swaying in the body. We don't. All right. Go ahead and have a seat. Okay. And so now what I'm going to do is part of a stroke assessment. And what we're going to do is we're going to give the patient an item, or they may look at a picture and they need to tell us what that item is. Sometimes with patients, if they have had strokes, then they're not able to use their words correctly and they may use an improper word for a certain picture. Can you tell me what this is?
Remote.
Okay. Can you tell me what this is?
A coaster.
Okay. All right. The next thing we're going to do, I'm going to ask you to, and what I'm doing with this assessment is I'm looking for equal rise in the facial features. If you will, raise your eyebrows for me. Okay. And then can you close your eyes shut really tight? Okay. And then can you smile? Okay. All right. Okay, open your eyes now. Okay. Let's see. I believe that this concludes our neurological exam.